Hi, everyone. Thank you so much for joining yet another episode of FCPI podcast. And in today's episode, we are exploring opportunities for clinical pharmacists in Australia. So, in the past 9 episodes, we were exploring different arenas of clinical pharmacy at a global level. And I'm really, really excited for today's episode because I have here one of my very good friends and who was my classmate in when I was doing my PharmD. So I've known him for the last 15 years, and it's such a great pleasure to have him on my podcast. So very warm welcome to Abhijith, who has agreed to be our guest for the day. So, to just give you a brief overview or brief background about Abhijit, like I mentioned, he was my classmate. So, we did PharmD together at Amrita School of Pharmacy. And in 2017, he joined as a clinical pharmacist in the transplant unit at GI surgery department here in Amrita Hospital. Then he moved on to becoming a lecturer at Amrita School of Pharmacy in 2022. Later on in 2023, he moved to Australia where he started his career as a community pharmacist. And last year, he became a licensed clinical pharmacist at a public hospital. And now he is in the transition phase of moving to a different hospital at the moment. So, the purpose of the podcast today is to basically explore how has it been the journey from as a clinical pharmacist from India to being a clinical pharmacist in the Australia. So we are not going to really touch too much upon the actual nitty-gritties of visa processing and those aspects, but we'll be mostly focusing on skill development, training, and what is it like a journey for clinical pharmacists who move from India to Australia. So thank you so much, Abhijit, and welcome. I would like to welcome you to the podcast episode.
Thank you, Dr. Vrinda. Thank you for that long introduction.
I
Uh,
wasn't that long.
like there was like a running joke in my family that my CV is mostly Amrita, 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 and
Yeah.
then something else. It has mostly been the same thing. But
Yeah.
as you said, so it has actually helped me to probably give me the foundational experience or the qualification for what I'm currently doing. So thank you for that. Um, So I'd probably start by saying that, like, working as a clinical pharmacist in India and then moving on to Australia. So it has been challenging to actually start with, even though the things that we actually do or the roles and responsibilities are quite the same thing. But
Hmm.
it's mostly adjusting to a new system, new healthcare system. All of those things has been the challenging aspect of it, which I'm pretty sure that if you're in any field,
Yep.
let alone pharmacy or any field, that's something that we might have to adjust to. So as you said, I started since I migrated to Australia. I've done my internship, which is part of the process. So we'll have to complete the equivalency exam. Uh, that's the first step. And the next major step would be completing an internship, which is more about acclimatizing to the Australian healthcare system. So I think the internship was 1,500 hours, which was about like 9 to 10 months of it. And after that, we'll have to sit for a different set of examination, like a written exam and an oral exam, whereas it's more like a viva kind of thing. So there are two
Right.
steps of the intern exams as well, after which you actually get to become a general pharmacist in Australia. So I've worked probably 1 year after that as a general pharmacist. I've worked in the community setup, after which I've got the opportunity to transition to a clinical pharmacist role. So to start with, I'd probably say the three sets, like being a Indian clinical pharmacist or in the Indian healthcare system, the community pharmacy in Australia, and the clinical pharmacy again in Australia. So the base of it is probably the same. So
Right.
any qualification, so let it be like a PharmD or a B Pharm or an M Pharm, any qualification that you get from overseas, that is the core activities. I'd probably use the term the core activities would remain the same.
Hmm.
Um, so in community pharmacy in Australia, I'd probably say we would be serving. So if we are looking at as a patient management plan or patient treatment plan, so we'd be serving the last part of it where we are
Correct.
dispensing the
Correct.
medication,
Correct.
giving the counseling.
Mm.
So a pharmacist, community pharmacist is not much involved in the decision making process,
Right.
but
Right.
where
Right.
they act as the final step of the management plan,
Mm.
where if there is any discrepancies or like anything that needs to be sorted out, that can be done. So when coming to the clinical pharmacy part, I'd say that there is more involvement in deciding what the
Correct.
treatment plan
Correct.
might actually look like,
Correct.
which is similar to what we do as a clinical pharmacist in India. So I'd probably say again, as a clinical pharmacist, few changes that I had to adjust to would be the healthcare setting. So the way that the prescription is actually written, like some of the simpler
Mm-hmm.
things, if I have to go through, those would be completely different. And there is also the aspect of how the medication is actually procured in a hospital or in a pharmacy, whereas the in India, the concept of prescriptions, the complete prescription thing, a repeat of a prescription where the doctor can actually write for a fixed number of repeats that can be obtained from a particular prescription.
Right.
Things like
Right.
that are
Right.
different.
Right. Right.
So again, uh, if I have to start with the differences, that would be it.
Mm.
But I'd probably also start with what I actually do as a clinical pharmacist in
So
Australia.
I
Probably,
think, sorry to interrupt you. So I think I would like to just rewind to about like 5, 6 years back before
yeah,
you move to the actual work that you're doing. So
yeah,
basically, like when we graduated in 2016, the scenario was very different. Like unlike what it is right now, because I would say we were practically pretty much clueless about what is the role that we can play, what are the kind of opportunities that we have. And I think most of us just grabbed on to the first opportunity that we got. We didn't really explore so much on what is it that we can do, but it was more on the job training, on the job exploration, and things like that that we did back then. But I think probably it was around 2019, 2020 that you decided to move, that you want to take a chance and try Australian caps. And I actually want to start off like, why Australia? Why did you choose Australia? Because I don't think it was a big trend back then to write caps exam, unlike now, because right now I think a lot of our young clinical pharmacists are attempting caps exam. But
yeah.
back then, I think you were quite one of the initial few people who attempted CAP. So I am actually, from a very personal point, also, I'm very interested to know why you chose Australia over the other millions of countries.
So I don't think this answer might be very motivating because the only reason I had to like choose Australia was that few of my friends were already here.
Right.
So they actually had an idea on what the actual system is going to be like. So it was quite systematic, if you ask me. So write the first exam, do the internship, that system was in place. And for me personally, I didn't know what the other things,
Correct.
the system is in other countries. So it's mostly my ignorance to the system in the other countries that might have actually led, and the fact that a few of my friends had already come to Australia. I think they hadn't written the CAPS exam at that point, but they were here for their higher education. So I was actually exposed to the idea that people could actually do this, try this
Hmm.
step there.
Right.
And I would also say like that I didn't have the biggest idea what this exam was actually going to be like. So I was someone who got into the exam, and maybe then I realized that this is something that I need to like spend a bit more time on, and it is not like it is not it is unlike exam that you give at the end of your year, like when you're
Right.
studying,
University
where you just
exams.
brush up on what you've. I don't know how. So the way that I did things and you did things would be different, but at least for me that didn't work. So there was this point of realization where that I have to maybe upskill a bit.
Mm-hmm.
So for me personally, I did um, prepare for the exam while I was working as a clinical pharmacist.
Right, right.
I'd also say that working at the department that I worked at, so just like in your introduction, I did work at the GI surgery department. So that was the Department of Gastrointestinal Surgery and Organ Transplant, where the department was actually quite significant, did quite significant number of liver transplants.
Mm,
So I was under the team of Dr. Sudhindran, so who has been like a really great mentor. So maybe have working at that department, working at the critical care unit, it gave me a bit of a confidence.
correct.
And I'd probably give you an example where when I actually went into the exam, and we had this case scenarios or like case studies that come, like probably there'll be like a case study and few questions based on that.
Mm-hmm.
So I found that these were something that I saw regularly in the day, like, so
Mm,
that
right,
actually gave me like a bit of confidence.
right, right,
So,
right.
and also the fact that the department that I worked at was quite welcoming to the roles and responsibilities of the CP, that
Correct, correct,
also actually helped me.
correct.
So preparing for the exam while working as a clinical pharmacist, even though it, I'd probably say that that was the most stressful time,
Yeah,
at least during my working
yeah.
years. So uh,
But in a way, it
like
helped you. The
it,
training
I
helped.
would say that it helped me, like
Mm,
working at a critical care department, seeing the volume of patients that I actually
mm-hmm,
so at that point, that actually helped. So I gave the exam. I was planning to probably give the exam in 2019.
mm-hmm.
Again, it was not very popular as it is now.
Yeah,
So it was the CAPS exam back then. And I think from this year, it has been restructured or redesigned into OPRA exam, OPRA. I think it's Overseas Pharmacist Readiness Assessment, I guess. So it
okay,
has been probably restructured in a way that it's more clinical now,
correct.
whereas previously it was the CAPS exam. It had two papers where
Mm-hmm.
one was more like therapeutics and oncology oriented, pharmacology oriented, where the other was more like um, pharmaceutics or medicinal chemistry oriented.
So it's the same
It's not.
exam for community pharmacist and clinical pharmacist, right?
It is. It is.
Okay.
Yeah. So as the first step, even now, so the OPRA exam, even if you want to pursue your career as a community pharmacist here, or even if as a clinical pharmacist, that is the step that every pharmacist, any pharmacist
Okay.
who wants to work at Australia has to go through.
Okay.
And for me, I completed my exam just before COVID. So this is
Hmm.
2020. I think this is March, and the day that I got my results was the day that actually the
The lockdown
lockdown happened.
happened. Okay.
So then there was this huge period of uncertainty for at least
Mm.
2 years. So
Okay.
I probably understand what all of the recent the people who have completed my caps has gone through, but at
Hmm.
least at that point, nobody had an idea like
Hmm.
what's coming
Yeah,
in
yeah,
next.
of course.
So the borders were shut and all that. So I had to wait for a couple more years to actually like, process my visas and all that and come to Australia and start my internship. So as a part of the journey, after you've completed the exam, so that's opera exam now, so the next step is to actually start an internship in any pharmacy in Australia. So realistically, I think it's always going to be in community. So
Okay.
it's very, very rare that uh, a pharmacist, overseas pharmacist, might get the opportunity to start as a intern
Intern.
in a hospital.
Okay.
So
Okay.
maybe it's my experience, but I've never come across someone who has come from overseas. So the interns in the hospital has almost always been the students who work here, like
Mm-hmm.
the
Okay.
fourth year
Okay. The
students or
university students from
the
Australia itself.
university students.
Right, right.
But just like I said, that doesn't really matter. So it's
Mm-hmm.
for us, the step or the final destination would be to get into the general registration,
Mm-hmm.
after which we can actually explore from community, hospital, industry, or research. There are many options out there. But to start with, probably internship at any place. Most
Right.
probably, it could be in the community pharmacy.
And
So
when you were,
I
sorry, go ahead, go ahead.
no no no. If
No, I was just asking. So when you were preparing for your exam, if I remember correctly, you did not go for any professional or formal coaching as such. You prepared on your own. So what were kind of the materials that you referred, and were there any specific textbooks that were like a syllabus that was there for CAPS exam? How was that preparation like?
So the biggest thing about the exam is that there is no fixed syllabus as such.
Okay,
So if
okay,
you go into the website, even for the opera exam now, they actually mention just the subjects. So
okay.
it's most anything that comes below that subject or
There are
comes
no
under that.
topics as such.
So there are no specific topics, but you
Okay.
could see. So it would be a very generalized version of the subjects that we might have
Oh,
already studied
right,
during the
right.
PharmD or MPharm or BPharm. Uh, so that was one of the challenging things where when you are getting into it and when you don't really have the training part
Mm,
of it, you the best option would be to go like have a really good base on what is happening. So I'd say even with now, I might not be exactly right, but from what I could see when they restructured the CAPS exam to the opera, the part that they've actually taken away are mostly from the subjects that consist of pharmaceutics, or they've
mm.
trimmed down on the medicinal chemistry and all of those subjects,
So it's more
and
clinical now,
it's more clinical. So
right?
I think the percentage wise distribution would be the therapeutics, the toxicology, and the pharmacology. That'd be somewhere around like 50 to 60 percentage of all the
Oh,
questions,
okay,
and
okay.
all of them are multiple choice questions. So
Mm, mm.
it's not as if you have to write the
Yeah,
exam there. So
essay, right?
it's multiple choice, but it might be a tricky situation as well. So when you're
Hmm,
given so the direct questions were a medication is given and being asked of what the side effect could be, those
hmm.
questions would be very few, maybe two or
Okay,
three.
okay.
Everything else would be structured in a way that there is a clinical scenario, and there
Right,
might be like
right,
few questions based on that. There might be tricky questions in there.
right.
It
So
goes
you
that
really
way.
need to know your content well to answer the question.
I'd probably say so. So
Right.
just like I said, probably 60% would be all of the clinical things that we mentioned. Um, 10 to 15% on like pharmacokinetics and pharmacodynamics and things like that. I think there is also 20% of biomedical sciences where it's like pathophysiology, anatomy, all of
Mm-hmm,
those things.
mm-hmm, mm-hmm.
So you can't probably like completely avoid one of those core subjects and think that you'll probably be getting most out of the other ones. You'll need to have a base on all of that.
Right.
So the resources that I've gone through might be a bit outdated, but from what I remember, I went through the Lippincott textbook for the
Mm-hmm.
pharmacology. There was also some uh, I might be completely wrong. I've completely forgotten the name of the textbook, but the one that used to help for the NAPLEX exam.
Okay.
So it some of the core uh, subjects or chapters from there that was also being referred. So this might not be like an ideal training thing to actually
Mm-hmm.
recommend,
Mm-hmm.
but back then those were the options that we could have. So there
Correct.
was a Facebook group that I was a part of where people actually discussed
Mm.
on
Okay.
what the actual thing is, which might have completely changed. So please don't take my word for
Yeah.
it.
Yeah, but I
You'd be
think
better
there are
off
still
asking someone
similar
who's.
similar groups like that
I
for
think that, yeah,
certification programs and
could be.
overseas exams.
Yeah,
And
yeah.
you found that helpful, yes? Is it? Those kind of
I've
groups?
definitely found that helpful. But the fact of the matter is that even if you refer textbooks like that, at the end of the day, the questions might be or the formatting of the questions might be a bit different.
Mm.
So it's better to actually go through like all of the other references that you might have, like something like a lexicon or an up to date would
Mm-hmm.
actually help you give the exact information. So for me, it was not particularly what the actual dose is going to be. Those questions were very few. Like
Okay.
I'd
Direct
probably say
questions.
none to few. Like
Mm.
super specific questions, like what is the exact dose of this
Mm.
medication?
Mm.
We didn't really have much in that, but it's mostly, uh, I'd say probably say two things. One would be the if the therapy is appropriate,
Mm.
so
Okay.
there
Okay.
might even if there are like few options like the first line agent or second line agent, the case study or the question would be phrased in such a way that if this particular therapy is the drug of choice, or is some situation that's preventing us from using the first line agent, whereas you need to go. So that's what I mean by the statement that the questions might be a bit more clinical.
Right, right, right.
So rather than just going through algorithm of what the
Hmm.
treatment is going to be, you are there to actually make a recommendation
Hmm.
which actually mimics what we actually do
In
as a
real
clinical
life.
pharmacist.
Yeah. So,
Yeah.
like in our PharmD curriculum, you might agree that it's very theoretical. Like what we learn, it's like even the pharmacology, even the therapeutics, even though we are learning it for 2 to 3 years, it's very theoretical that we learn. And it's mostly when we come to the clinical side during our internship or post our graduation, when we work as a clinical pharmacist, that's when we actually see things in a clinical perspective. So for someone who has just completed their PharmD degree and who's trying to appear for CAPS exam, uh, is there any recommendation from your side on how they should approach the training materials? Like how should they prepare themselves? Because they don't have a lot of clinical exposure. And when, like you were saying, a lot of the questions would be from a very kind of a tricky question and a person who has some clinical experience would
Creatively.
be able
Yeah.
to answer that. So is there any, so how would I say it? Like tips or tricks from your side for someone who has just graduated or who's like very early in their career for them to approach the training? Uh,
So I'd probably say, just like I said, you can't get all of those information from just one reference
hmm.
book or a reference range. So I would probably recommend. So for me, what actually helped was the fact that I was actually working for
Right,
a
right,
bit.
right.
So my recommendation would be to probably I'm sure that with even with FCPI, there are few modules or things that actually give you the real life, which
Yep.
mimics the real life situations that a pharmacist could go through. So if you're not working as a clinical pharmacist, or if you're doing like something completely different but still want to give the CAPS exam, I'd probably go refer some of the clinical guidelines per se.
Mhm. Okay, okay.
So some of the universal guidelines. So something for like a guideline for
Society
hypertension,
recommended
diabetes, which
guidelines.
are supposed, yeah, definitely, which are supposed to be probably unique. Sorry, not
Mm,
unique. It's the same everywhere.
yeah.
There
Widely
might be
accepted.
some tweaking with some institutional guidelines or something like that. So for few of the topics that I needed to prepare where I did not have the proper exposure to, so because I
Mm,
was working in a critical care unit
right,
and
right.
let's say I was not exposed to endocrinology
Mm,
or nephrology or something of that sort. Probably going through some of the universal guidelines or even something specific to the medications that are being given there, choice of a anti-diabetic medication,
mm,
antihypertensive.
mm.
This would seem very basic
Yep.
for someone who has been working so far, but for a exam point of view, when you're preparing, something like this could actually give you an idea on what the choice of selection. So if I have to go
Mm-hmm.
back to the part where I was mentioning about the choice of an agent,
Mm-hmm.
you
Mm-hmm.
have multiple options. Which one would you give? So probably few of the guidelines would actually help with that.
Okay.
But in my experience, probably having that experience, being in that situation, and probably thinking of the thought process, what could go there.
Mm-hmm. Mm-hmm.
So I'd probably say I have always thought if I have to have a selection of an agent, we can actually think of what the proper contraindication could be.
Mm.
So I have three options. I'd probably be thinking about the contraindication. So which one is not
Okay.
the appropriate
Okay.
agent? So probably that's one way of
Approaching the
thinking about
question.
it.
Hmm.
But for your question, I don't have a complete answer, but this is something that can be tried out.
Right.
But again, so preparing for a specific exam, it might not be exactly the same way that you'd be going into working as a clinical pharmacist. So you'd need to have more references, or you'd need to have a broader idea. So rather than we being like really experienced in one particular core field or like a
Mm.
super specialty experience, preparing or sitting for an exam would mean that you need to have a broader
Right.
experience
Right.
on,
Right.
or at least how to go about it.
Right.
So yeah, I think the answer might have been all over the place, but
No,
the
but I
thing
think
that
that's really helpful because and I just wanted to emphasize also on the point that even if a PharmD graduate is trying to appear for CAPS, they should make use of their internship period because, like you mentioned, they are going to
I
different
think so.
departments and
Yeah.
they're being exposed to different clinical scenarios. So I think that can also be considered as like a training for them for attending overseas exams.
Yeah. Especially with the changes in the formatting of the examination and the clinical aspect of it, I definitely think that could actually help.
And how is it? So you talked about the transitioning from being an Indian clinical pharmacist to an Australian pharmacist. So how has the work culture been like? What sort of a difference do you see in the work culture between the two countries? And how easy or difficult was it for you to adapt to the new environment?
I'd probably I'd say this is in two different parts. So adjusting to the healthcare system or healthcare part of it was really difficult for me because I didn't have any clue what Australian healthcare actually
Mm,
looked like. So
right.
that is also one recommendation that I probably make for anyone who's like coming in, if they can actually. There are few modules that are available on some of the pharmacy associations that actually work here. Like there is the Pharmaceutical Society of Australia, which is PSA. So they actually provide a module where you'll be exposed to like a Australian healthcare system essentials, if that makes sense.
Okay.
So things
Just
to
giving
know
you an
before you
overview
start.
of the healthcare
Definitely.
system.
So
Okay,
I'd say
that's
for
useful.
me, I I didn't have an idea on that. So my first day of work, I was actually expected to know all this, and this was like
Oh,
completely overwhelming, as if I was drowning with information.
right.
Didn't have
I
it.
can imagine that.
So yeah, uh, the thing is that you'll have to be completely like fully switched on while you start a new work,
Mm,
and because of the overload of information, I was finding it really difficult,
correct.
and also the fact that I've adjusted to a new set of people. Sometimes accents can be a bit challenging.
Of
So
course.
you would have already heard the Australian accent thing where
Yeah,
it's
yeah,
a bit more like, so I'm completely adjusted to that now.
yeah.
But starting your workforce in a regional part in Australia and
And especially in a
have this
community
love
pharmacy where you're
as a
actually
community
meeting
pharmacy, we
people.
are like completely, you'll be talking throughout the shift. Like if it's an 8 hour
Mm,
shift, you'll be talking short. So that part was actually a bit challenging, but um, one of the advantages, or I would say advantages, the output of the system that we have here. So
mm-hmm.
once you start start your internship, you have to be on an internship training program. So that's a requirement for you to actually complete the internship. So there
Okay,
are many associations that actually provide that. So I did it under, and like mine was under Pharmacy Guild of Australia, which is
okay,
one association. So
okay.
there is also the Pharmaceutical Society of Australia, which I mentioned before. I
Mm-hmm.
think the Monash Health University, they provide one of that. Each of them would be different. So the way that it works is that we are actually expected to. It's more like a course
Mm-hmm.
where you enroll for a course. You're
So
expected to
this is
do the
during your internship?
it has to be done during the
Oh,
internship.
okay, okay,
So you'll definitely be working in a pharmacy, learning your things, dispensing, getting to know all of that. And at the same time, you are expected to complete the. So think of it as a course that you do during the
okay.
internship. And it is actually called the internship training program.
Mm-hmm.
So up, for you to appear for the exam at the end of the internship, you need to complete the internship
Oh,
training
it's a
program.
mandate.
Yeah, I think you can sit for the exam before, but for the
Mm.
result to come and for you to be like a general
Licensed
pharmacist,
pharmacist.
licensed pharmacist, the internship training
Ah,
program has to be completed.
okay.
So you'll have a preceptor from the same pharmacy, which you'll probably notify the association or the organization. So for me, I did it under Pharmacy Guild of Australia. They actually had many modules or courses like workshops, like 2 day workshops at the end of the like sorry, beginning of the internship and at the end, where they actually give you an overview of what the Australian healthcare system looks like. So my recommendation would be that because these workshops happen maybe a month or two after you start the internship, it would be better for any of pharmacist who's like planning to migrate to Australia to maybe have a very basic overview of this course, so that the
Hmm.
first few weeks are not as overwhelming as it could be.
Okay. Okay.
The other part of working in Australia, I'd say that uh, so in general, I found the overall work culture in Australia had to be like a bit more chilled compared to what it's in. I'm not talking about the pharmacy in general. Like
Okay.
people, I've found people to be like a bit more
More
laid
work-life
back.
balance.
Definitely. So like few things that if you punch out of your job, you are
That's
not
it.
expected to take the
Done.
call and stuff like that. I actually love that here. And the fact that in general, because I might be generalizing here, but like in India, because we have like a monthly salary kind of system,
Hmm.
overwork is not quite it's not
Entertained.
paid for. No, like you might have to do a bit of overwork which is not quite paid for, but
Hmm.
whereas in here, even if it's like a minute above your fixed time,
Oh,
the employer is have to, like by rule, have
okay.
to pay you that
Okay.
extra money. And so
Nice.
working in the weekend has to be it'll have the extra amount. Working during the public holidays, even if you're working at night, like even if it's past 7 o'clock, it has that penalty rate where you'll be
Hmm.
paid more.
Okay.
So this has nothing to do with the pharmacy profession per se, but what I'm saying is that so all of those, the laws, the general
Hmm.
laws
Yeah,
are
yeah.
a bit more relaxed, or like it's more helpful to the employee.
Employee friendly.
uh, it's more employee friendly, I'd say. And in general, like just like I said, I think from what I've spoken to my friends who are working in other places as well, I think maybe in Australia that there is a bit of like work like balance thing where you're not expected to like stress out or
Hmm. Hmm.
completely.
Correct.
So
Correct.
that's even I've found while transitioning to like a hospital setup. I went from working in a community pharmacy where we only had like 4 or 5 people. There might be days where you're like completely stressed out, but moving into a hospital where it's a huge department, like it's a huge pharmacy department, close to 150 pharmacists working in different departments though. But that the workflow part of it actually,
It's more
uh,
streamlined and structured.
yeah, that's right. Yeah, yeah.
Hmm.
So those would be some of the takeaways from
Nice.
the way things are done in here.
And is it like, do
Uh,
you have different shifts or is it a straight shift for pharmacist there? A clinical
uh,
pharmacist.
as for clinical pharmacists, most of the days I have been doing normal shifting. Well, it's like from more like a 9 to 5:30,
Hmm. 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 Hmm.
9 to 5 or 9 to 5:30. But there are few days where I have to do a late shift, which is more like a 11 to 7 or sometimes 12 to 8. So
Okay.
8 is the maximum that I'm expected to stay until.
Okay.
There'll be few days where I have to stay back, but um, so those are the two shifts that I have done as a clinical pharmacist in a hospital. But in pharmacy, it's completely different. It depends on which pharmacy you work at. So in the pharmacy that I worked at, I usually did like a complete evening shift. So it was
Okay.
always starting at 3 o'clock in the evening and working until 11. So
Okay.
I stay up late,
Okay.
wake up late, and so that was the shift that I was put on. But there was also options of other shifts. So
And
it all depends on where you actually work at.
hmm, hmm. And how is a clinical pharmacy like in Australia? Because in India, like you would already know that we are still face a lot of institutions still have resistance from clinicians and clinical pharmacists cannot able to sort of perform to their optimal level. They are having resistance from clinicians. But I believe, or it's my understanding that in countries like Australia, UK, US, clinical pharmacy is more established. It has been there in place for a long, like over 2 decades now. So how is it like for clinical pharmacists? Are they well accepted in your scenario?
I'd say so. Like, I think it might be a bit more than probably 2 decades in a
Mm-hmm.
system like in Australia. Not exactly sure when
Hmm.
that might have started, but for me, I have been working as a rotational clinical pharmacist. So that's the job title. And From last year till until now, I had been working at Monash Health, which is a public hospital, and now I'm in the process of transitioning from one public hospital to the other. So it's called Northern Health. So these are all the public hospitals in Melbourne. Um, so the system in or like the roles and responsibilities for a rotational clinical pharmacist is quite similar to start with. If I have to compare between in India, or at least what I've done, because it might be different in different institutions. So for me, because I was employed under the Department of Gastrointestinal Surgery in my hospital, I
Right,
didn't have
right.
the exposure to other departments.
Correct, correct.
Whereas in here, because I'm employed under the pharmacy department or clinical pharmacy department,
You have more exposure
um,
to different departments there.
yeah, so I'd probably say that it's close to when I've done the internship.
Okay. You're posted in
So for
different
different
departments.
department.
Hmm.
So the main so the rotation that I had was at the specialty medicine. So specialty medicine is one team of
Okay.
clinical pharmacy, which has like almost all of the specialties. So like nephrology, transplant, even surgeries actually comes under. So the ones that we actually know, which is
Hmm.
similar to what we have in India. So if I have to say, I might be doing for a couple of weeks. I might be working as a surgery pharmacist, surgery clinical pharmacist. And maybe the next week I'll be expected to be covering a different part of the specialty. It mostly is the same departments or similar departments. The A complete change in department would come when someone is actually called in sick and the
Ah, you have to
workflow needs
cover
to be
for them.
balanced. Yeah, and we'd probably be covering for a different pharmacist where uh, I think the expectation is that we'll have to maybe complete few of the works they might have done before. So
Hmm.
that's the first part of it, and then we might initiate something like a discharge that they might not have done. So that's a new kind of work. So the way to make it more simpler, I'd say that there are like three or four core activities.
Okay.
So the
It's
first
similar
one,
for all departments.
this would be similar for all the
Okay.
departments. So
Okay.
this is similar to what we've done before as well, but I'd say the first one would be uh history taking. So it's
Hmm.
called best possible medication history, or
Okay.
BPMH. So the best possible is quite significant because uh, suppose I'm going in for a new patient. So there is an admission. The patient might have come into the ED or to a department they have completely. So once the patient is there, I'll have to go to the patient and get their complete history. So we are there for the medication history, but we have to also look at few things like the allergy history, or like something as simple as there might be the medication history has to be comprehensive, but there are instances where we won't get the complete thing out of it. So I'll give you an example because the sources of the history is quite it's a really important part here.
Okay.
So we need to be getting the information out of at least two really credible sources. So the one
Oh,
can be the patient, but that cannot be the just the source.
end of
So
it.
there is also a system called My Health Record, which is the system that tracks the dispensing of the prescriptions. So which I think this is something that's like completely different in here, where we as a pharmacist can track how the patient has been taking the medication, because in
Hmm.
India we don't really have the dispensing
Correct, correct.
the system of it. So the patient might be getting one medication from
One
outside
pharmacy going to
pharmacy,
another
maybe
one.
somewhere else, then from a hospital.
Yep,
We don't
true.
really have a tracking system there. So if I have to go to a patient, I'll probably talk to them about why
Hmm.
I'm there, maybe warm up with like few questions.
Hmm.
Then I'll ask them about all of the medication that they have. I've found that maybe many patients they know their medication management. They'll probably write down in their own book or they have their own system there. But then again, the purpose of the history part, this I have not done back in India. So
Hmm.
a few of the extra questions that we ask are regarding what medication changes has been happening recently. So for example, the patient might be on a medication, let's say antihypertensive medication. And they've had 2 hospital admissions, but in between, a local physician or a local specialist might have actually changed the dose of it. So the
Right.
dose of 40 has been increased to 80. But if I don't do the history checking there, the hospital system would put through the 40 that was there before,
Oh,
if that
okay.
makes
Got it.
sense.
Got it. Got
So
it.
the
Got it.
changes in any medication management is quite important, and that's what the pharmacist is expected to take. And there are also few things we'll be looking at: any drug interactions, any contraindications. All of those things are same, but the system by which we go through and documentation is everything. And this is something that I struggled again
Mm.
while starting. Everything has to be documented. Any word that I have with the patient has to be. So there is the electronic medical record
Yep.
where I can prepare the pharmacist
Mm-hmm.
admission note, everything. Or if there is any discrepancy that I think I'll have to call the GP. So GP is the primary physician. So
Okay.
they go by GP. That's the general practitioner.
Practitioner.
And as per the Australian healthcare system, GP is the primary. So any illness, you'll probably go to the GP. They'll probably sort it out. And if it's need to be referred to a specialist, the GP has to do it by
So you
themselves.
can't directly go to a super specialist. Huh.
It's very probably for something like a dermatology. I've seen people actually booking a
Mm.
specialist, but for something like a cardiology or super specific things, it has to go through that pathway.
Okay.
So it has its advantages and disadvantages. Like, let's say in India, I've seen, because I worked in gastrointestinal surgery, people have
Yeah.
actually come to GI surgery just for a stomach ache, whereas they should have just gone for the physician.
Yeah.
But also the fact that the system in India would allow us to actually maybe detect some of the things early.
Earlier.
So
Hmm.
it's a delicate balance of not overdoing it and getting the proper
Got it.
management at the
Got it.
same time. So coming back to Australia, so there are instances where I as a hospital pharmacist will probably have to call the GP or the GP clinic and assess the changes in health. Like, the patient might not know that the dose might have been changed. So these are all of the sources that we have to go through, and it is an
Mm-hmm.
extensive process. So at least the change for me, that when I did that back in India, I'd probably go through the medication list that they have,
Yeah. Yeah. Yeah.
and the concept was that we'll take it from here. Like,
Mm.
we'll maybe like change all of that and give you like an updated medication profile or updated medication list. So whereas in here the history is a bit more, it has to be considered. And because
Right.
it's a public hospital, there is always, if there are any changes that need to be notified back to the GP.
Mm.
So there
Oh,
are
okay.
extra layers to. So the medication management would be continued through a patient's GP or of their choice.
So
Sometimes they
just
might
just
change.
just a question there. Like, so when a patient gets admitted to your hospital, suppose he or she was under a care for another GP, can you still access those GP's notes through your electronic medical records?
I can probably see the prescriptions, the
Okay.
ones that have been prescribed for this particular patient, but not the notes.
Okay. Okay.
So we
You
wouldn't
have to
really
still
need the notes.
you still have to
Yeah. So
call
if,
back
if
and
I
ask.
feel that there is a discrepancy and the patient is not able to give you a good answer, the my health record, like the dispensing system
Mm.
is not able to give me a good answer, the bystand. So there are sometimes like a language barrier as well,
Yep.
because within Australia it's like a really multicultural
Yeah.
place at
Yeah.
the
Yeah.
moment.
Yeah.
So all of these situations is when we'll have to probably go and
Okay.
talk to
Got
the
it.
the
Got
the
it.
doctor outside, who's outside the hospital.
Hmm.
So that is one part of it, which is a really I just mentioned this in detail because this is something that's completely different from
Yeah. Yeah. Of
what
course.
I've done back in India,
Yeah.
or like something that needs to be expected. So the next core activity would be like a inpatient management. So now the patient has been admitted, the management has to happen in the hospital. So we'll assess all of their prescriptions for, I'd say, two things: appropriateness. So
Hmm.
if this patient actually needs this medication, there are chances that they might be reusing. So let's say proton pump inhibitor, they wouldn't really need to be on it. So
But
this
they're
is the part
continuing it.
where, yeah, I'll assess. I'll do a pharmaceutical review or like chart review for the patient, and assess it for ongoing indication. So that's one keyword that I actually like, ongoing indication,
Mm.
if they need it now, and for an appropriateness. So appropriateness could be anything where like the renal function is not quite the same, so we'll have
Your
to do
basic five
adjustments on the next.
hours indication, dose,
Yeah,
duration, frequency. Yeah.
all of that things. So that's more like a chart review. So most probably like the second step there. And this is where we actually like communicate with the doctors. So coming back to your question, I might have totally missed the part there.
No.
So the one thing that I've also found is that back in India, when I was actually making a recommendation, I think this might be like a really important point. I was not very confident all the time with my
Of course.
resources.
Of course.
So in Australia, at least the main resources that we go, so there is the Australian Medication Handbook, which is also known as AMH,
Mm-hmm.
available online, and you can also have like a copy of it, which is published every year. So any changes in the guidelines, all of things are there. There is also something called like a therapeutic guideline, which actually goes through all of the guidelines. So if you know the up to date or the lexicon, this is like a separate part just with the guidelines.
Oh, okay.
So I'll give you an example. So if I have to go and look at the anticoagulant recommendation for a particular patient, but with a bleeding risk, so
You can just
general
check in
advice
that.
can be obtained from anywhere. So if there are something like super specific or um, drug of choice for a pregnant woman, all of those things.
Hmm.
So this
It's a
is
very
the
tailored recommendation.
yeah. So that is also like a really systemic thing that because we have the resources, I feel like because we have the resources, we'll feel more confident giving in these recommendations. And I'd also say because when I came in, because I was an early career pharmacist, I still believe in the hospital setting in Australia, I'm an early career pharmacist. But all of the senior staff, they were like really confident in talking to the doctors.
Mm.
And I could see that they had the respect from the doctors, so
Right.
which actually gives us a confidence.
Hmm.
So the team leader that I had, he was like really he's really thorough with his recommendations. So he wouldn't just give a very basic recommendation. The way he structured a recommendation would be that he'll be throwing in all of the references, and probably the wording that he'll use will be like really diplomatic so that the doctors will be like, yeah, definitely.
Yeah.
I've never seen his recommendations get thrown out of the
Rejected.
window,
Okay.
never rejected. So like it's also the experience part of it, the way
Of
you talk
course.
to the doctors. I wouldn't say that every recommendation by every pharmacist or even by me has been accepted. There has been situations where the doctors would again consider the clinical
Hmm.
scenario of the patient. It could
Of
be
course.
different, but I found most of the recommendations to be accepting. But at the same time, the 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 rate at which we are given, I wouldn't say the word rate, but maybe the number of recommendations is limited, and the recommendations need to have a bit
Yeah.
of quality when it comes to.
Hmm.
It can't be a recommendation or like an intervention for the sake of an intervention. It needs to have a really good base of references or resources. Or for me, when I was starting out, I'd probably, even if I have a recommendation or intervention, I'd probably phrase it as a question. So that
Right.
so I'm going in your department and I'm meeting with probably it could be an intern or a PG doctor, like a registrar, or
Mm-hmm.
it'll be like the lowest part of the
Yeah,
hierarchy. It
yeah.
couldn't be directly be the consultant right
Consultant
there.
level. Hmm.
So I could see that they'll be more receptive to the recommendations, but the very few audiences where I had to talk to the consultant, I've always made it. So we have to be like really diplomatic again.
Of
So I
course.
made it. I'll probably be phrasing it as a question. So I found that because the system has been there for many years, and there has been many pharmacists who has done this before me. So
They're
there is always
familiar with that interaction.
they are familiar with that. Like rather than us being thrown into the system, they
Mhm.
are actually like receptive to the fact that we are there, and
Okay.
they
They know
actually
what you're
want
doing.
us to be there. Yeah. So at least in the hospital that I've worked with, I've not had much issues with that.
Got it.
But there also been few instances where I thought my recommendation was like quite significant, but it was not
Yeah.
considered at that point. But then I could see that the patient might have had a recent admission or like a different admission after that, and I was actually able to connect these two and probably like restructure my
Hmm.
recommendation. There have been things like that,
Right,
but in
right.
general, yeah, yeah,
Yeah. And so this therapeutic guideline that you're saying, is that like
yeah.
a mobile app, or
So
how do you
it's
access it?
yeah. So in the hospital, you can actually access this in every computer.
Oh,
So
okay.
think of as in like in most of the institutions, you'd have an access to up to date, where the
Hmm.
institution has to
Yeah.
actually
Subscription, like, yeah.
subscribe to that. Yeah. So I think this almost all of the, because it's a
Got it.
public hospital, all of the resources are free. I'm not exactly sure how it works in other hospital,
Right.
but I think it's the minimum requirement that all of the requirement has to be there for you to actually function as even as community pharmacy. So a very small pharmacy that I worked in, they were also expected to have all of those resources
Hmm.
so that the
Okay.
pharmacists can actually work better, if
Okay.
that makes sense.
Okay.
So
Okay.
that is also like a really huge change, I'd say, because
Okay.
with the references, we get the base.
Right.
Going back to the first, like few of the first question that you've asked me regarding preparing for the exam, again, a lack of references or resources could be something that might be holding us back in
Hmm.
few of the regards.
Mm-hmm.
But yeah. Uh, so again, with the recommendation, I'd probably sorry resource, I'd probably have to ask. Working in a public hospital, there are institutional guidelines
Right.
which are
Hospital
also like
guidelines.
hospital guidelines which are super specific. So there is a particular website, like intranet website, where it'd be easier for me to give an example. Suppose I have to check for like hyperkalemia in what particular scenario. So if I go and search for the keyword, I'd probably be getting a detailed PDF with the brands that are available, because
In that
unlike in India,
hospital.
in the hospital, unlike in India, like the
Nice.
brands that are available would stay the same consistently. Like it would almost be the same. So
Okay.
there aren't like hundreds of brands that are available, and this particular hospital might have few, the other hospital might have few. You're not
Hmm.
expected to know all of the brands. Um, so the institutional guidelines would also give you like another really good example would be that there is concept for antibiotic use, which you would also find interesting. So there is something called like a traffic light antibiotic usage in here. So there are red, green, and orange. So green are the antibiotic which can be used for almost all of the indications, all of your
It's
broad
more like
spectrum ones,
aware
all of
index
the.
classification, access, watch, reserve
It
kind of.
is. Yep,
Huh.
yep, definitely.
Yeah.
And orange would be something that can be given for one particular indication without any restriction, but for anything else, it needs to have an ID
Hmm.
approval. And red is something that has to have an ID approval. So that's how they
Reserve
track the
antibiotic.
resistance and
Hmm.
all that. I found that like really helpful starting out as a hospital pharmacist or clinical pharmacist, where I'd probably be thinking about the color. I'd probably color code the things.
Right,
It's
right,
easier for me that way.
right.
Uh, so all of these are like institutional specific. I think it's mostly for all of the public hospitals, but
Got it.
resources part of it, excellent for anyone who's starting out. And I really feel that if this had not been there, so if it's something that I need to pay for or like I need to subscribe for, the clinical knowledge or the improvement or the upskilling that I would have in the last few years would have been completely different.
Hmm.
So I'd probably say that that is something that I would see for all of the hospitals in India to actually implement.
Hmm.
If anyone who's working as a pharmacist, clinical pharmacist, has given the same level of resources that can be given,
Hmm.
I think that
The
it's
quality
going to be
also
like a
will
really,
improve a
the
lot.
quality would really improve. Yeah.
Yeah. So just going back to our initial discussion about that in the process of becoming a clinical pharmacist in Australia. So you talked in depth about the examination part. So suppose a clinical pharmacist from India has cleared the exam. What are the next steps like? So you talked about internship. So how does one apply for the internship? How is that process like?
Um, I have to mention something else as well, because at the current scenario, like getting into the next step would also involve a lot of visa options and all that, which, as I know, has been the roadblock for most of the people. So many have actually completed the exam, but getting into the visa is like really difficult. I'd probably say what I actually did. So for me, I had actually applied for the skilled migration visa, which is a 190. That's the visa name. But because it was taking forever, I had the option, like, oh, at that point I had the reference to go for like a trainee visa. It is called 407 visa, which is just for 1 year. So that's when you are expected to complete the internship. It will be somewhere between like 9 to 10 months, and then you can actually go from that visa, trainee visa, to a different visa. It could be
Okay.
like an employer sponsored visa or even skilled migration visa. But for me, because my skilled visa was already approved at that point,
You could
I
transition
came
quickly
into
to it.
Australia with the trainee visa, but in a couple of months, because the other visa came in, I had to change. But this might not be the case for everyone.
Correct.
And I also understand that the current scenario has been really difficult because the wait is somewhere between like 20 months to 22 months, which is close to 2 years at this point, which also makes it really difficult for someone who has done the caps to get
Hmm.
into an internship before the caps,
The
for the
validity
opera exam, that
expires.
it expires. I'd say I don't have the updated information at this point, or I'd always recommend maybe going to an migration agent or
Agency. Correct. Correct.
getting the information. But yeah, so trainee visa are an option, but I've seen that it's really rare. Like the numbers are really low compared to when I got it 2 years ago. It might also be the fact that have not been exposed to many people who are coming through that system. It might still be happening. So any visa like 407 would be a trainee visa, or if you can get like a skilled migration thing, you'll once you get the visa, you can apply to any of the pharmacies, and it can also work through that way.
So you apply for internship only after you get the visa, is it?
So if it's a trainee visa, it comes as a part of it. Like you apply for the trainee visa, it gets ready, and you're already there in place for the internship once the visa comes in.
Oh, okay.
But if it's the other way around, so you have to apply for the skilled visa, and once you have the visa, so that's when you know that when you come into Australia, or you have an idea when you can actually come into Australia. But that at the moment is like a really long wait. So
Hmm.
I'm not exactly sure how that would work out. I've also seen other people who have come in different visas, like a partner visa. They come in here
Yeah, yeah,
and
spouse
then
visa
they
sort of.
up spouse visas and all that.
Okay.
So again, not too super specific, going in super
Yeah,
specific
yeah, yeah,
with.
of course. Yeah. So you complete the exam, you get the visa, and then you apply for internship. And then how do you apply for internship? Do you as a pharmacist select where you want to work, or is there like a criteria that you need to fulfill?
I think it could be similar to applying for any other jobs. So
Okay.
you'll probably have to go and search for the internship opportunity that they're giving. So many pharmacies actually take in a lot of interns.
Hmm.
But in general, what I've seen is that there'll be like a lot of students who actually have just recently graduated the university. They might actually need to do a bit of internship, or
So
there can
these are the
also be
Australian students who have
Australian students. Yeah.
okay,
Yep.
okay.
From an Australian university, sorry.
Hmm.
So the two pathways would be, or two or three pathways. One would be the overseas pharmacist. One would be the students who have just completed the university, and also I think people coming from few select countries where the healthcare system is similar, like Canada or UK or Ireland. I think they also have a different stream. Not
Oh,
exactly sure though,
okay,
but
okay. Hmm,
it,
hmm.
it, it might not be the same. So those are the set of people that come in. So you come in for the internship. I've already discussed about the internship training program and all that. And at the end of the internship, once you've completed the hours, you have to sit for two exams. So one is a written exam, again, which is similar. It's not quite the written thing. It's a
Hmm.
MCQ, but it's known as the written exam, which is similar to a CAPS exam.
CAPS
But this
exam.
time it's going to be like super specific to the system that we are currently on. So it's not going to be a theory oriented thing. It's more like a general pharmacy practice kind of thing in Australia.
Right, right.
Along with you'll also have clinical questions, which is similar to CAPS or OPERA exam. Um, the good thing is that this is an open book exam, so you can
Okay.
actually take in all of the resources. But I found that like really, really overwhelming because you wouldn't really get the time
Yeah.
to actually.
Refer
So
and right.
yeah, if you have a resource, let's say like the Australian Medicine Handbook, and you have like selected all of that, and there are few points that you just know where to go to at that point, it
Yeah.
might actually help. But if you're not preparing and just bringing a book and thinking that you can just wipe the pages, it wouldn't work
That
that way.
okay.
So that's the one part of it. The
So
other
basically,
part,
you should know where to look at in
yeah,
in that 1 year of internship. You should know where to
it's just that it's
refer.
an open book exam, but think of it as an opera or a CAPS exam. The
Yeah.
same, it's similar. And the other part is the intern oral exam,
Mm-hmm.
which again is more like a viva.
Hmm.
So it has three parts. So part A, B, and C. So part A is more like it's a minor illness kind of thing, like all of the over-the-counter medications that you actually have an exposure to while you're working as an intern. Uh, I'd probably like ask if has the light gone
Yeah,
on? So
it's
should I just
yeah, it's coming and going in between. That's okay. We can
is it
still
okay if I
see you.
just need to
No,
like
no, no, it's
turn
okay.
on
We
the
can
light?
still see you. We can still see you.
So as for the intern exam, so the first part is minor illness. So it will be like a role play thing where the examiner would actually act as a uh, patient,
Oh,
and it's mostly on how you are asked all of the questions, get the proper history out of it. So
skill
in the role
assessment
play,
kind of.
yeah, yeah. So they'll probably be they'll have a particular illness. So they'll say that I have this symptoms. You'll have to ask all of the questions and find out what the actual thing is, and then give
Hmm.
him a recommendation. So
Hmm.
I've actually seen people fail at this exam where because you have to ask all sorts of questions. So I'll give you an example. One of my colleagues who was actually like really brilliant pharmacist, but during the question he didn't ask the profession of the who was coming in
The
as in the role
okay.
play. So
Okay.
the guy was supposed to be a truck driver, so it was there in the script, and the
Oh,
recommendation was given for something that's like sedating antihistamine, which is not ideal in that scenario. So that's
correct,
the kind of
correct.
thing like tricky things
Hmm.
that could come in, which but I'd say that it's most basic. And part B would be like the rules and regulations, so more of a jurisprudence kind of
Hmm.
things that's super specific to pharmacy in Australia. So the rules, there are like drugs of dependence that are actually like kept in safe, like one part of it, like
Narcotics. Hmm.
yeah, narcotics and all that. And the third part is the more tricky part. So there will be like a case scenario where again it will be a role play. We'll have to ask all of the questions, get everything out of it, and actually give a recommendation. So the examiner would act as the patient, and if needed he'll act as the doctor. So sometimes I'll have to assess the prescription. Maybe I'll see a drug interactions or like a contraindication, dose, or like there might be something in there. But then I'll have to call the doctor. I'll have to mimic the real scenario, and uh, so
Okay.
that's the part C of it. So this is the oral exam. Like that's format for the oral exam. And once we pass both the exams and the intern training, the program, the training program that I mentioned before, that's when you will be given like a general registration, which has to be renewed every year, just like we have it in India. And this is at this point is where you if you want to actually make a switch to a hospital or stay in community, that's when you can actually decide. But until this point, I think the journey is going to be the same for almost all of the pharmacists, unless they can actually get into a hospital setting from overseas.
Yeah.
um, and I'd say for me, working as a clinical pharmacist for a few years in India has actually helped me with the interview process when I actually applied for working at Monash. So I wouldn't say recommendation, but
Your
the takeaway
experience.
from
Hmm.
yeah working in India as a clinical pharmacist has actually helped me.
Okay.
So had I not had that experience, I would have actually had to go through a different set of maybe do some courses or
Okay.
do
Okay.
some clinical things in there.
Right.
So that's probably something that I
And how easy is it like to get a job after internship? Is it quite like, do they give out calls very frequently for pharmacists?
I'd say after internship, it might be a bit easy compared to getting into
Getting
an
the
internship.
okay,
The
okay.
fir- that could be like really maybe really stressful, or
Mm.
that could take a while.
The
So I don't
initial
really
entry
want
point is the most difficult.
entry point. I think
Mm.
in general for any jobs in Australia, even for my friends, they've all found the first few months coming in here that to be like the really stressful part of it. And after the internship, because you complete the internship, have a general registration, you have many options. You can
Correct.
even go to industries, or mostly it's going to be like community pharmacies. You can apply for like regional areas where there'll always be demand if you're willing to actually relocate to all of those areas. So there are many options. So after internship, I'd say the ride gets smoother, but the rougher part would be like when you start out.
And even
Um,
if you want to work in the industry, you need to clear all this process.
uh, Again, that is a bit of tricky part
Okay.
in there, because otherwise what I've seen people do is that they might actually need to do a specific course for that
Okay.
particular industry,
From
even if it's like
Australia.
pharmaceutical from Australia. So
Oh,
that's what
okay.
I've seen people do.
Hmm.
I don't really think for industry, being a general pharmacist is it's a requirement.
Hmm.
So maybe people who have done pharmacy outside of Australia, they might still choose not to go through the opera, the internship pathway, and rather they go in
Do
for
a
a course
course.
and then, yeah.
Hmm.
I've seen very few,
Right.
so I don't really have an output on how
Yeah,
the
yeah, yeah.
industry part of it works.
Correct, correct.
Um, but
And
I think
yeah,
even for like a research, or even if you have to pursue a PhD, I don't really think the CAPS pathway is a mandatory
mandate.
thing.
Hmm.
It's not a mandate. It's not a requirement for
Hmm.
you to actually hold a general registration with the pharmacy board. Um, but they would actually because the entry point part of it is like really difficult. They would
Hmm.
actually want you to have all of that.
Right. And I think I'm coming to the final few questions. I think what I'm really interested to know from you is, because you have experience of both the worlds, uh, what would be your recommendation in terms of skill development for clinical pharmacists in India if they want, not just Australia, but in general, if they want to pursue a career elsewhere? What are some of the skills that they need to develop as clinical pharmacy students, interns, and early career pharmacists?
Probably staying up to date with all of the changes, or the medication management part of it would be one thing. So in Australia, I could see that there is like the CPDs, like the continuing professional
Pharmacy,
development.
huh? Hmm.
So that is also a requirement for me to actually hold on to my registration as a pharmacist. I need to have like 40 points of CPD every year before I renew. I'd say if you can actually attend all of the seminars, or
Hmm. Hmm.
keeping up to date, because I might be a bit ignorant here, but I'm not exactly sure if there is a specific pathway where you can track your continuing education or all of those things. I
Hmm.
don't really know if we have that in India. Um, but even if you are starting out, even if you are not readily working as a clinical pharmacist, having that exposure to what's happening around you, or keeping up to date with all of the things that we've mentioned, probably a good idea to get into your resources, or like have that
Hmm.
group of people that could actually help you. These can all help. So because I don't exactly know the
Hmm.
scenario, but maybe uh, diving into a bit of CPDs, or continuing professional development part
Right.
of it, would be like a starting point,
Right.
and you can take it from there. Because once you migrate to any part of any other country, or even if it's Australia or Canada or US, you'll have to adjust to what the actual healthcare setting there
Of
is.
course.
So having like a universal idea on what happens on other
Hmm.
places would be a good starting point.
Right. And just from the discussion we were having, I think a few takeaways for me are just that one, communication skills are very important. So, like how you
Definitely, yeah.
structure your recommendation, how you approach a clinician, how you approach a resident, registrar. All those soft skill development definitely matters.
Definitely. I
Networking.
might not have actually like touched based on that, but I would also would say that it actually improves. So like when you're starting, you're not always going to be on the A game. So you will always have a scope of improvement. But even with when you're starting, having a bit of confidence on what you're actually telling. So even if you know that this might not be like an ideal thing, but if you feel like this has to be mentioned just in case, so the communication part of like really polishing what you're going to say,
Mhm.
that can actually take you, because it's not just the recommendation being approved or not. It's not a checklist thing. It actually gives us an idea on how to present the next one. So
Right.
soft skills like speaking definitely actually helps. But I'd also say this because I've seen people who come from India, or like in general, I've seen that it is actually quite good. They're quite good with the communication compared to people from other places. Some of them, even though they have like really good clinical knowledge, I've seen. I'm not like nitpicking people from other
Yeah,
countries,
yeah,
but
yeah.
they actually struggle in the initial few months, but then they
Mm.
pick up and they
Mm.
get really good to it. But at least I've seen people from India actually have, because I don't know, because if it's like they have the exposure before, but few of my colleagues, they've been like really confident on giving their recommendation, that has actually given me a bit of confidence. uh,
Right.
so yep,
Yeah.
definitely
Yeah.
communication.
Yeah. And second thing I felt is networking is very important, especially when you're moving to a different country. You need to have some good contacts there just to understand the scenario, just to make yourself more better acclimatized to the environment. So I think even as clinical pharmacists from India, make use of platforms like, LinkedIn and other resources, connect with people abroad. Uh, don't bother them too much. I think that's a big thing to say. Don't just keep on bombarding them with questions, DMs, and things like that. But just having that network of people, I think, definitely helps. And I think the most important thing is know your stuff well, like being
Yeah,
up to
that's right.
date, and not just having the theoretical knowledge, but knowing how to apply that knowledge into clinical practice. I think that's the most important thing. Yeah, and I think just a final question for you is, just looking back at your journey. It's been what, almost 10 years since you have started practicing as a clinical pharmacist. What has been like a most memorable, most rewarding moment for you? It could be from Australia, it could be from India, but something that stands out to you. Just a closing curious question, that's all.
Uh, I'd probably say that like there are instances where I- definitely there has been many situations where we actually are able to give like a really good intervention, give recommendation, but there are few instances where when we actually give the patient counseling.
Mhm.
So I'd say it, I don't know if it's like very rewarding or not. We could actually see that we may have made a difference there.
Mm.
Even working in like in a community pharmacy, really busy pharmacy, I've had people who come back to the pharmacy and say they've been like really thankful for the recommendation, and I didn't really know how to respond to that. I've never seen people. It's like I'm just nitpicking here.
Yeah.
So that is something that even back in India when I was like working in the
Hmm.
transplant unit, we could see that people were like really appreciative of. It might be a really really simple thing for us. It's just one information that we are passing through, but that the way that they take it, that could be a bit it feel rewarding for us. I've had similar instances like working in community and clinical pharmacy in Australia as well. So maybe that
Okay.
I'd probably go with that.
Right. Thank you so much, Abhijit. I think I just went a bit overboard with the timing. Really sorry about
Oh,
that. But
sorry.
this was a very honest communication I felt, and I am sure that what the information that you shared would be super useful for a lot of clinical pharmacists who would be seeing this podcast. So thanks a lot for your time and for the information that you shared. Yeah, thank you so much.
I think I started out when it was like really bright in here, and I've ended out when it's almost
Yeah, we
dark.
saw the climate
But
change in Australia in through this episode. You gave
yep,
us a flavor of that.
yep, and
Right.
it's like really cold. It's getting into the winter part of it, so it's getting really cold. That's what I'm feeling
Right.
in this weather. And thank you so much for having me. So I didn't really, not in my wildest dreams, I thought I'd be like talking this much about something that, like for me,
About your
we've always
journey.
talked about this before. Yeah, it's like for me, when we speak about it, this is like a similar things, or we're just updating on what happening. But to be actually able to talk in detail, some of the things I had to actually refresh, like
Mm.
working in the community for something. Only when I'm talking to you or just now, I'm refreshing many things that I might have done. So this has been like super
Reflexive process
helpful.
for you as well.
Yep, yep, it has. And thank you for having, and like thank you for FCPA for having me, giving me this opportunity. And I really feel like this could be helpful for a lot of people. At least I've been able to give you an idea of what actually is being, all the roles and responsibilities, what the changes are. And I'm always happy to, if anyone has any questions, I'm always happy to actually help you with that. But maybe not with the visa things, because I don't really
Yeah.
know at
Yeah.
this particular point.
Yes.
uh, Everything else for the professional part of it, I'm really happy to actually answer any questions if you have any queries. And thank you again for this
Yeah.
opportunity.
Yeah, so just a pointer at the end. Visa related questions, I think Abhijit has already made it clear that go through an agent because the
Yep.
rules keep changing and he may not be super updated on everything. You can't expect him to answer all those questions. But anything related to skill development and, actual career in Australia, he might be able to help you with. But please be, a bit, what do you say, considerate and not bombard him with a lot of questions. Yeah, but thank you so much, Abhijit. I think we'll wind up the episode. Thank you, everyone, for your
Yep.
patient listening. Bye bye. Take care.
Thank you.